mimics, right? So the symptoms which we said about facial weakness, the arm weakness, the speech problems can also happen in other conditions which can mimic stroke. So one of the condition for which you said is fluid, which is called a subdural collection within the brain. And these days we have specialized treatments for that. It need not always be opened up. Just before a few years down the line, the only treatment for that was to create small holes in the skull and suck out that blood.
Even from this one, spinal cord or something?
Spinal cord also would have it, but that would not probably cause the symptoms which we associate with stroke. The brain fluid can mimic stroke and can cause these type of symptoms similarly, and that is why imaging plays a very important role. Why we do that imaging is to detect stroke and separate it out from other stroke mimics. And for the subdural collection which you said, we have a procedure called as, again we can go through the arteries and block certain arteries which would result in those type of effusions. We call it as middle meningeal artery embolization. So these type of procedures can be done to prevent such recurrences or to prevent its expansion further.
Does it happen only on the left side or any side?
It can happen any side, and usually after a trauma, small trauma.
Sir, due to this
Damage to the brain is irreversible. So irreversible. Okay, so that is why time becomes important. What we are trying to do is not to recover those which are already damaged. Say if a road is supplying it, it can divide into multiple branches. So it supplies 100 different areas there. The faster you come, maybe only say 10% of that part would have got affected, that area. But you have some 90% still remaining which will get affected if you don't treat them.
But that 10% cannot be
10% cannot be reversed. That is why the importance of time is there. So that is why we are stressing on the fact that out of the FAST, F-A-S-T, F when you detect facial weakness, arm, speech, and then T is time to act fast again, or time to call, time to take for help. And that is what we stress on, that time is important.
Madam?
E refers to eyes. You can have blurring of vision in one eye, or you can also have complete loss of vision in an eye. This can also be a sign of stroke. Now, whatever fast we say, sometimes it may be very transient. In the sense, you may have a little bit of weakness in your arm, you may have a facial deviation, and it will improve, maybe within few seconds or minutes. That does not mean that we need to ignore them. It still means that it is a stroke. So it is a different type. We say it is transient ischemic attack. So these are transient episodes. It's kind of a warning sign. So this also means that you need to rush to the hospital. See, every minute there are 2 million brain cells or neurons which die. So the faster you are, the more amount of brain tissue we are able to save. So the early treatment, we restore the blood flow and better will be the chances of recovery. So ultimately we are preventing disability.
Now you have a comprehensive unit.
These are as of now predominantly in the major corporates or major hospitals which you would see. So and there are these days they accredit such programs as well. For example, Manipal Hospital is NABH accredited. NABH accreditation for a generalized hospital is different, that most of the hospitals will have. Especially in particular for stroke program itself, there are NABH accreditations which are available. Means you have to meet certain standards. The hospital has to meet certain standards in terms of having all of these things. And there are various parameters, 70 odd parameters which they look at, and you have to fulfill all those parameters before you are labeled as NABH accredited stroke. And I think we were the second or the third hospital in the country to probably to have this accreditation first. So basically there are set parameters on how these are decided, and yes, so that based on that you have a proper program in terms of how these stroke patients come in and how they are treated until they recover and go.
What is the
certain risk factors in terms of it could be just the age itself, the elderly age, because over a period there are depositions of these cholesterol, fat, calcium, all of these which block the artery. It could be in terms of sedentary lifestyles which most of us have, in terms of long hours of sitting not having regular exercises, not good dietary habits, and there are other risk factors in terms of habits such as smoking, tobacco chewing. All of these also could play a role, and these days even stress has always been a factor which has been implicated in most of these chronic diseases. Then obviously your other risk factors such as the blood pressure, cholesterol, sugar, all of these play an important role, and controlling all of these risk factors would help us to reduce any of these chronic diseases.
Doctor,
We were talking about the acute stroke management here, so where the Doppler is not playing an important role, but otherwise, as a screening tool, that is very, very important test which we would recommend also in terms of it's a ultrasound like we do for the abdomen and those things. Here also in the neck, we can look at those blood vessels and depositions of these materials, which could be cholesterol, calcium, and those kind of things, whether that is causing any narrowing of those blood vessels or not. And there are certain criteria beyond which these are supposed to be treated in terms of either an operation. If it's more than 70% narrowing of that blood vessel, then we usually reopen such vessels. And one of the techniques to reopen is open surgery called as endarterectomy, or the similar way how we are doing this angiogram. The same way we go in and put a stent. We dilate this thing and dilate that area of narrowing by a balloon, and then we put a stent. So either carotid revascularization surgery, which is called as endarterectomy, or a stenting procedure can be done. So as a screening tool, that becomes very important for us to follow up and see whether any type of such procedures are required or not.
That's all straight.
So if everything was...
They can live with it.
So disability is quite a bad thing to have, and you're talking about a stroke patient who is having, say, weakness of one side of the hand, foot, who is dependent now for each of his activities on another person, and we forgot what is the stroke caregiver's burden which is there. Not just the patient suffers, the whole family suffers, and the caregivers suffer. So obviously our whole talk of today, our whole interest of this thing is to minimize such disabilities, and that is what we were all talking about. So obviously not all strokes lead to death. If it were to lead to death, we were probably not talking about any of such treatments. That's a completely wrong concept. Stroke is treatable, and it is one of the best treatment success rates. It is like even better than taking an antibiotic for your routine infections. You have a cold, you take antibiotic and we feel better. Such type of stroke treatments are far better than that type of a treatment. So the importance is, when stroke we identify, earlier you come, earlier we diagnose, earlier we save, the better is the recovery, lesser is the disability, and death obviously will become a small chunk of those type of cases then.
Doctor, what is the quantum of success rate in these surgeries?
Yeah. So once we open, if we successfully open, it's a large vessel block. As we said, we talk about small strokes and large strokes. Small strokes do not need these type of specialized procedures, and they are treated with medicines itself, or maximum with those IV drugs which we talk about. If it is a large stroke, that's when the disability is high, and if we are able to open up the vessel, it is almost like 40% to 50% of these patients we are able to get them to what they were initially. So that's quite a big number. When I say 40-50, it might look small, but no, in medical literature, 50% means 1 in every 2 patients which I treat, the patient probably can come back to normal life. And that is a very, very useful impact on his life, because as I said, he is fully free of disabilities then, and that itself is reducing, he is back to normal in his family life as well. So that is the importance of having such emergency treatments.
What about alternative healing techniques and the people who look out for the treatment in those methods?
So if your question is about alternating techniques like yoga, meditation, all of these as a preventive measure, yes, they all have a role. But if you ask this question when you diagnose a patient to have acute stroke, then the only proven treatment is to rush them to hospital and open that. It is as simple as this. A artery or a pipe is blocked. Unless the pipe is opened, blood flow is not going to happen. If you have a pipe being blocked at your home, the first thing which you would want to do is open that, remove those dirt which is there away, so that you don't have that rush of whatever other collecting materials which are there. So you would want to open that vessel first. So there's no other treatment, no other alternative treatment which will be effective in acute stroke. Mechanical thrombectomy in large vessel strokes, acute stroke, is the way to go.